All right. Good morning, everybody. Uh, I hope everybody is managing the heat well. I was just talking to Dan before, and how ironic that our training today focuses on heat stress and prevention when we're dealing with such a high amount of heat out there today. On top of that, I just saw that we're going to have an air quality issue because of some wildfires that are happening to the north of us. So might be a little extra taxing on some people that struggle respiratory wise with this heat, but also adding in the air quality issues can really be dangerous. So what a great time to have this training. And so we'll get started. So today we're going to be focusing on heat stress and prevention. Okay. The main reason we do this is so we can recognize the signs, prevent any illnesses for ourselves and also our coworkers. It's really important. We're going to talk a lot about the buddy system today, how to keep an eye on our coworkers as well as ourselves. So, the most common things that we see with heat related is it happens fast. Okay, when people are working, it can happen pretty quick. So we're going to understand what heat stress is. We're going to identify the illness. How can we recognize it? Right, the symptoms, preventing heat illness related problems. That is going to be probably our biggest focal point on how to prevent some of this, and then how to respond if we do have a heat related emergency. Okay. So what is heat stress? Okay. Heat stress is basically when our body cannot cool itself effectively any longer. So our body does a really good job of regulating our temperatures, right? When you get a fever, that means that we're fighting off an infection. In the hot days like today, our problem is with the high humidity rates. When our body needs to cool down, we secrete sweat, right? And when we get air movement across our skin with the sweat, it evaporates, which causes our body to cool. But unfortunately today, and most of the week actually, the humidity is so high that our bodies can't evaporate our sweat as effective. So what happens is our core body temperatures increase, and then what happens is we get very symptomatic. Okay, some other factors that we have out there is obviously the heat, right? Obviously the humidity, but also the sun, right? If you're working in the direct sunlight, that can really dehydrate you quickly and also can raise your body core temperature up as well. Any heavy type of work we're doing out there, if you're doing a lot of manual labor, right, you're putting extra stress on the body, using muscles, burning energy, all contributes to heat stress. So, and actually we're finding a lot of PPE, right? Some places have to wear, like if they're welders, they have really heavy garments that they have to wear. Bump hats, hard hats, those all don't breathe very well. So PPE could also be a factor out there. And we're going to discuss some of that today. All right. So who do you guys think is at risk for this, right? We always think about, yep, construction workers, of course, anybody who works outside, but honestly, it's a lot of people out there that you don't really realize. Outdoor workers is one of the biggest ones, all right? And that kind of hits home with Bliffert because you have a lot of outdoor workers in the lumber yards, right, who are maybe in direct sunlight or maybe don't have enough shade. Who knows what the factors could be? But also some of our manufacturing facilities. There's a lot of manufacturing that happens in Wisconsin, and some of these buildings are massive, right? Some of these production facilities are huge, so it's very hard to keep those areas climate controlled. So unfortunately, some of those areas get really, really warm, especially if they're making things like plastics or metals and stuff like that, where they're actually adding heat to the building on these hot days as well with big furnaces. So those people really do feel this effect as well. Kitchen workers, obviously, because we're adding heat again, and not always is it the most climate controlled area. Construction workers, for sure. They're outside, right? Especially, I feel really bad for a lot of our roofing contractors, excuse me, who are out there. They they're in the direct sunlight, working on darker colored roofs. If they're putting rubber roof down, can you imagine how warm it is up there with the heat reflecting off of the roof? So they're getting it from not only the sun, but also the reflection off of the hot roof. So those poor guys really do not do well in this type of weather. So agricultural, our farmers, Our gardeners, all the people that have to work outside for sure, right? Those are hard. And then maintenance guys, people don't realize as well that a lot of equipment maintenance workers, like forklift maintenance workers, um, people who have to work on heavy equipment, for sure they are on the elements, right? And also that's heavy work too. So they're really stressing their bodies that way. But also our HVAC people, right? The people who go up on the roofs to make sure our air conditioners are working. That's very, very taxing on those folks because it is so hot up there. So a lot of things to consider. There's a lot of at-risk people for this, especially anybody who may have respiratory issues, chronic illnesses. We see a lot of patients like our chemotherapy patients. They don't handle this type of weather well. So it's just a lot of mix of people who really struggle through this. So it's a very important topic. So some of the most common ones that we see, the heat related illnesses out there, is the heat rash, cramping, exhaustion, and then heat stroke. Okay. So in my career, working in emergency medicine as a paramedic, I didn't see a whole lot of heat strokes in Wisconsin, mainly because our nights do end up cooling off. But heat stroke really sets in when you are consistently in a very hot, humid climate for a long duration. But we'll talk about that as well. Okay. Heat rash. I don't know if anybody has ever experienced any type of heat rash. It's usually a red raised rash, commonly on the neck, chest, and back. That's where we see a lot of it. It can be itchy, can be burning sensation. All depends on how the person reacts to it. But if we're starting to get cramps, folks, then it's time to realize that, okay, we're getting to the point where our body is dehydrated, okay? And that's a big problem because once we start down that slope of dehydration, if we don't take immediate actions to rehydrate quickly, we can slip into a heat stroke pretty quickly. And those are very hard symptoms to treat once they get to that point. All right. So what are some of the warning signs? All right, folks, we really want to know these like the back of our hand. Obvious ones are sweating, right? Weakness, headache. Once we start hitting the dizziness, confusion, cramps, and even nausea, we're to the point where this person would it's now time for an emergency response. Okay. The reason why is once the dizziness and confusion hit in, that means that we are so dehydrated or our core temperature is so high that it's starting to affect us neurologically. And that's a really big indicator that we are pretty far along in this heat illness, and we need to definitely take some precautions and start doing some interventions. Okay. Nausea is dangerous, of course, because it dehydrates us, right? If anybody's ever had a bout of the stomach flu, you know how bad you crave water. That's because of how dehydrated that can make us. So that's a very dangerous sign when we get to the heat part. Okay. So how do we prevent some of this? Prevention is absolute key and is the best way that we can prevent this, right? Taking breaks. And I don't mean like 3 a day, right? Take like 4 or 5 small breaks, right? Just to let your body cool down a bit. Use shade, air conditioning if it's available. Surprisingly, even some good airflow in a shaded area on a hot day like today can really help cool the body down. Okay. There's also some really cool stuff out on the markets these days, like these cooling towels. I bought some for my son who plays football, and sometimes it gets some hot days out there. And this cooling towel, you saturate with water, you can wrap it around their neck or their face or their top of their head. It really does wonders to help cool that body down. So drinking water about every 15 to 20 minutes, right? That's a big one. I actually advocate very highly to drink 1 bottle of water every 15 minutes. And then the next time you drink, do like a sports drink, a Gatorade or something that has electrolytes, sodium or potassium in it, because our body has a hard time absorbing water if we don't have enough sodium and potassium electrolytes in our body. So oftentimes people are like, I'm drinking so much, my urine is clear. That's good, but unfortunately your body is expelling a lot of the water because it can't absorb it. It doesn't have enough sodium, because when we sweat, we have a ton of sodium come out of when we are sweating. And if it's out there hot days like today, we sweat a lot. So you are depleting not only, water, but you're also depleting the salinity of your body, which we need to have to absorb water. So keep that in mind as well, okay? And avoid any alcohol, right, if you can help it. That will obviously really dehydrate you as well, okay? So quicker than probably most things. So just be mindful of that. Another great tip that I like to share with people, if you have ice packs available, right? If you're really starting to feel kind of crappy, you're sweating a lot, you're dizzy, you're lightheaded, maybe a little nausea, a great place to put ice packs are in the armpits and in the groins and on the back of the neck, okay? The reason why is if anybody was through our first aid class, right? Tourniquets, they work really well in the armpits and groins because your large vessels are really close to the skin in your armpits and groin. And when you put ice packs on there, it actually cools the blood as it passes by. So it can help bring your core temperature down back to normal. So it is a very effective tool. Okay. Clothing. Here's another thing. All right. So depending on the workload, right? Some people have to wear a lot of PPE, but there are some really good devices and clothing options out there. Make sure it's really lightweight, breathable. So if there is a breeze, that it can pass through the fabric that you're wearing and get to your skin to help evaporate some of that moisture on you. That really helps bring your core body temperature down. All right. So make sure it's a breathable, lightweight clothing. Definitely hats, right? If your job requires you to have a bump hat or hard hat on, they do make ones that have some really good vents in them so that we can expel some of the heat from the top of our head, because that is where your body expels most heat, is off the top of our head. So we always want to make sure that we have some good ventilation on top, right? Sunscreen will definitely help. To be honest, days like today, sunscreen is kind of a waste because you sweat it off so fast, right? So just make sure that we kind of keep reapplying those sensitive areas with sunscreen. You can see in the picture here, this gentleman has got a big sun blocker hanging down over his neck. Those work really well. Some of those really lightweight fishing masks that you see out there that can cover the ears, the back of the head, the neck, all those areas are very helpful to try and keep us cool. Okay. So at what point do we want to call 911? All right. This is a question that we get a lot. Honestly, a lot of these symptoms that we start seeing are very treatable without an emergency response. Okay. As long as we recognize the signs and symptoms, right? We take our short breaks, try and keep ourselves as hydrated as possible. Usually we can avoid emergency response, but if in the event we do have somebody that is maybe has an altered mental status, meaning that they're not quite communicating a lot, or maybe they're complaining of cramps, their legs are cramped up, their arms are cramped up, they're not able to move. There's a lot of different symptoms that could happen, but those are the most common. Okay. So make sure the first thing we do is try and get these people into a cool area if possible. Air conditioning is the best option. Get them into an air conditioned space, get some fans set up, get some air movement across their body. That really helps a lot. Okay. Make sure we alert our supervisors immediately if we have to activate 911. Okay. Cool the person down as much as possible. And if they're still not responding well to you, okay, make sure we stay with them. All right. And this is where we want to put the ice packs in the armpits and groin area. Okay. Let's start cooling this person down as fast as possible. All right. Stay with them. Try to talk to them. Try and keep them engaged a little bit. Encourage them to maybe sip on a bottle of water, perhaps maybe even eat some ice chips, okay, if that's a possibility. I've even gotten to the point at a couple of triathlons we were at in Elkhart Lake area. We had a gentleman who was extremely overheated. I took his temperature, and his temperature was 104 degrees. So he was borderline getting to the point where heat stroke would have been the next step for him. So what we ended up doing is somebody had some ice in a cooler, so we packed his armpits with ice, his groin, and we actually ended up dumping cold water over his head, right? So to try and cool him down as fast as possible, and it's very successful. So, but definitely, if you are ever in doubt or you're not sure, If you're second guessing, always activate 911 for sure. It's better to be safe than sorry. Okay. So, what are some of the responsibilities that we need to do for ourselves, folks, as employees, right? Um, I mean, not just employees, but even on a normal day like today, if you're out doing yard work or whatever the case may be, hydrate, 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 hydrate. Okay. I'm a big fan. I don't know if you guys seen those out in the grocery stores or not. The liquid IVs. And they have quite a bit of sugar in them, but you can get sugar-free ones. But they really make a huge difference because it gives you exactly what your body needs to stay hydrated. Okay, so use packets like that. Electrolyte popsicles. I see a lot of places carry those too. It's a good thing to ingest, the popsicles because they're cold. They're full of electrolytes, right? It even gives you something cold to hold in your hand that helps a lot, right? Make sure we take a lot of short breaks if we can, right? Depending on your workload and all that. Make sure if you're doing something that's very exerting or you're really pushing it, just make sure we take those breaks. Okay. Report symptoms as well to any of your supervisors. If you're starting to get symptomatic, you're starting to mess with a slippery slope there. So just make sure that we are hydrating, taking breaks, and keeping yourself as cool as possible. All right. And make sure always we follow company's policy regarding reporting. Okay. So I often really stress this to people. Okay. Um, Especially with you folks, you have a lot of outdoor employees. I always do a heat safety checklist. I really recommend it for a lot of people, especially our contractors, our roofers, people like that. Make sure that they have a clear-cut expectations of what's going to happen today because of it being so hot. Make sure that they have water, breaks, provide shade if possible, right? But the biggest thing is too, folks, is know the symptoms. Understand what the symptoms are, because once the symptoms start, that is when we want to start doing interventions, all right, to try and help get these people cooled off the best we can, right? And watch our coworkers. This is where we talk about the buddy system, right? We want to make sure that we are definitely keeping an eye on each other, right? If somebody's starting to, maybe they're walking a little goofy, or maybe right, you notice that they are sweating profusely or their face is bright red, right? Even if they've developed sometimes trouble breathing, that's when we really want to start implementing our cool down procedures, right? Ice packs, water, air conditioning, lots of shade if possible, lots of air movement, okay? Because like I mentioned before, once we get past the point of these symptoms, they get worse, it's really hard to reverse these people, and normally it requires hospitalization. So the main thing is try to avoid those before it gets to that point. Okay. So I know we talked a lot about the heat, right? I know we talk a lot about things that we can do to help curve some of this, but remember, folks, the biggest thing is recognizing the symptoms. Okay. Then the next step is doing something about those symptoms once you see it. All right. If that means take a break, rehydrate, whatever the case may be, we want to avoid getting to the point of heat stroke. Okay. When our bodies hit heat stroke, we start losing core functions of our body. We can even actually have some organs start to shut down. All right. Because your body is basically cooking. Okay. So we want to really, really avoid that as much as possible. A lot of our local EMS providers, right? What they will do is ice packs, cold IV fluids is another thing that we will do. But make sure that we recognize these very, very, very often, and we want to do it very quickly, right? As soon as we have these symptoms, that's when we want to act. Okay. So make sure out there that we are providing plenty of shade, plenty of water to drink. Again, not just straight water if we can help it. If we could switch off between maybe like a Gatorade or electrolyte drink in between waters, that helps so much. So I know it's a lot of information out there, but really, please be safe, guys and gals, because once we start overheating, it can kind of get away from us really, really fast. So I know this was a little shorter of a training today, but an important one as well. Okay. So I hope everybody stays cool, stay safe, make sure that we are watching our coworkers. If if you notice somebody, do something about it, okay? Make sure we report any of these issues to our supervisors as well, okay? And again, anytime you guys see something, say something safety related, we can try to mitigate any type of hazards as fast as possible, okay? So with that, folks, I wish you a really, really happy day, and I hope we stay nice and cool out there, and have a great rest of your week. Thank you, everybody.